Like to call to order the July 23rd meeting of the Ashland Board of Health. The first thing on the agenda is citizen participation. Do I have any citizen participation? Go ahead, Mark.
Yes, thank you. Good evening. Mark Sony, 49 Hawthorne Road. This question is going to go through the chairman to Raj. If I can ask him a question, yes or no?
Sure, go ahead, Mark.
Thank you. Now, Raj, I've been going to the comprehensive plan committee meetings, and it's either being sparsely attended or full board attended, but not all the time with all boards and members and stuff like that. To the Board of Health, my question is to you, Roger, is how does the Board of Health determine what determines a nursing home in the Board of Health regulations?
Mr. Mark, your question is what determines nursing home?
Yes, how does the Board of Health see what a nursing home is in their eyes and regulations?
Sure. So most of the stuff with nursing home is regulated by state, but how we regulate nursing homes is like if they have food, like we have 2-3 of the nursing homes here, right, where we give food licensing, right, and regulate it that way. And then if we get any complaints, besides state regulation, we get involved. And then during COVID, right, we have assisted them, with supplies or COVID protocols and all that stuff, But if you ask me, it's direct regulation is by the state, not by the local Board of Health. They come under DPH.
Okay, the reason why I'm asking that, and I'll say it out loud. I was going through the comprehensive plan and vision Ashland goes, and that's one of the things I want to get in for the elders in the future. Once they're out of the house, once they're empty nesters and stuff like that, the age for nursing homes and how would be placed in that. So I was looking out in that turn just to find out what would look at and how and what would be in the future. So I'm just looking out down the road just in case. And the comprehensive plan vision statement is what I was going by. That's
Sure.
all. Thank you.
Thank you. Yeah.
Anybody else for citizen participation? Okay, so Raj, if you could take the next thing, introduction of the Board of Health intern.
Yes, sir. Mr. Chairman, we have Ashwin here, who have joined us for a very short-term internship. He's going for his pre-meds, and I will, Ashwin, if you can introduce yourself to the board, please.
Sure. Hello, everyone. My name is Ashwin Chandili, chemistry and molecular biology. I'm studying for the MCAT currently and planning to attend medical school in a year. And for the remainder of the summer, I'll be interning at the Board of Health, shadowing the vaccine clinic and working directly under Mr. Gupta.
Welcome aboard.
Welcome.
And did we rope him into the RAM clinic, Raj?
We will, sir. So he's just starting. We'll definitely do that. And then he's actually coming to the clinic tomorrow. So he's just getting started. So definitely, yes.
So that's a good exposure for him.
Yeah, it'll be, yes.
Definitely. Yeah.
Sign up online.
Keep up the good work, my friend.
Thank you for helping us.
Meet you.
All right. Raj, are you going to do the reappointment of the tobacco control agent?
Absolutely, sir. So Mr. Pari is with us, So, Mr. Chairman, if you want to give that, if you want to just take a vote on that, I guess
Sure.
That's how to do it,
Sure. So I would need a motion for the reappointment of, I cannot pronounce your name. I'm so sorry.
You can call me Pari.
So moved.
And I will second that. Does anybody have any questions or discussion?
None.
Okay, all in favor? Aye.
KG? Aye.
Yep. Congratulations for another year.
Thank you so much.
All right. Next thing on the agenda is the 14 Acton Road septic waiver requests.
And we have Mr. McIntyre, I guess. Dan, you with us? Mr. Chairman,
muted.
yeah,
Yes,
yeah, he's
I'm
here.
here. Would you like me to bring up the plan or?
Sure.
The sharing is disabled.
Laura, can you give him access?
Oh, there we go. Alrighty, can everybody see that?
Mhm.
So this is 14 Acton Road. The house is for sale and failed the Title V inspection. To orientate you, Acton Road is the bottom of the plan. The house is located here. There was a wetlands delineated toward the rear of the property and also a wetland across the street. That's connected by an underground culvert that runs through the property and across the street. The existing system is right in the side yard between the driveway, and the neighbor's property line. And that's really the only practical place to put the system back is in that same location. We did some test pits out there. The groundwater was relatively high at about 36 inches below grade. So we're proposing to put in an alternative technology, the geomat system in a pressure distribution design in order to get the required leaching area within this small footprint. So it involves a regular septic tank, a pump tank, and then a alternative technology bed design here. We're still raising the yard a little bit, but we are asking for a waiver on the 4-foot groundwater offset under the remedial use approval of this system by DEP. We are asking for a couple of waivers to the ashland regulations and Title V. Because the groundwater table was so high, we weren't able to do a percolation test. So we took samples of the soil and sent it to a laboratory for a sieve analysis
Why?
to obtain the design perk rate.
That's fine. We'll figure it out.
So that's a local upgrade waiver under Title V and a waiver under the ashland regulations for not having a percolation test. Due to the limited area in this lot, we just dug 2 test pits rather than the 3 required under the ashland regulations. But the soil is very consistent between those 2 test pits. So, but we are asking for a waiver on the 3rd test pit. In addition, ashland prohibits beds, but we are requesting a waiver on that since we're using an IA technology that goes into a bed format. And the distance to wetlands, the main wetlands in the back, we're meeting the 75-foot offset under the ashland regulations, but we're missing it slightly on the wetland across the street on the other side of Acton Road. We're about 60 feet off of that instead of 75. And then there's also a setback separation between a leach field and a underground culvert of 50 feet if the culvert intercepts the high groundwater table. We conservatively asked for this waiver because we don't know the condition of that pipe. Technically, that culvert should be solid and not intercept seasonal high groundwater, but it has been in the ground for a long time, so we don't know the condition of that culvert. So we're asking for that setback of 42 feet instead of 50 feet to that culvert that goes under the road. It's an existing 3-bedroom house. It's staying a 3-bedroom house. And that's the quick of it. If you have any questions, I can address those. It has been approved by conservation too.
Ed,
KG, go ahead.
yeah, question. Is that culvert carrying water all through the year or it's only intermittent?
Only intermittent, as water builds up in the wetland behind the house, it travels through the culvert and discharges on the other side of Acton Road.
And are you raising the land, mounding it up by how many inches or how many feet?
We're mounting it up by approximately a foot.
Does it require stabilization at the edges to make sure it doesn't breach?
Not on this particular one, no.
Okay, so it won't breach. All right. That's all.
Okay, anybody else have any questions? Okay, I'll entertain a motion.
So moved to give the waivers requested. Do we need to go one by one or we can go and
I know it needs someone to second it.
I'll second it.
Okay. Any other further discussion?
None.
All in favor? Aye,
Aye.
All right.
that's unanimous.
Thank you very much.
You're welcome. Thank you. So the next thing on the agenda is Clover Road Brewing Company at 151 Main Street for an external grease trap waiver request. Do we have any-
Ed, I have one small request for Raj.
Yes, please.
Sure.
Not
go ahead.
about this, but the previous one that ensure that the Concom has given the appropriate permission required for that.
They did, so yes, so
Thank
which, thank you.
Thank you. Thank you. Sorry for that. Ed.
So Raj, who's on for the brewing company?
Hi, I'm Jamie Muldoon. I'm here from Clover Road.
Okay, so if this is for an external grease trap waiver.
That's correct.
So can you give the board some information?
Yeah, so we're gonna have an internal grease trap, but we aren't going to have a lot of food. We're gonna have a very minimal menu that we currently have in Hudson. And actually in Hudson right now, we don't have a grease trap with the food that we serve. We have pretzel bites, we have hummus dip, we have charcuterie boxes. And so with the food that we have that has, we don't have a fryer, we don't use oil, a grease trap is typically not necessary. We are going, to do an internal one, as I mentioned before, but we aren't going to have a full kitchen. We're just doing snacks. So we are hoping that we can get a waiver for the external grease trap.
Raj, do you have anything to add to that?
Mr. Chairman, we should be good, we have an application from them. Given the menu, right, we should be good on going with the internal grease trap. But yes, on Jamie's point, we definitely gonna need one internally, given we have a fat regulation in town, so we're gonna need at least the internal one. So yes, but we have application from them, and we are good to go to give this waiver, please.
Okay. Anybody else have any questions?
No.
Okay, so I'll make a motion that we.
Oh, David has a question.
Yeah, sorry. I just had
David, I
a
didn't
couple.
see it. Sorry,
No,
David.
that's okay. I was slow, Ed. Sorry. No, the only question I had was, so how long have you been in operation in Hudson?
2 years.
So I guess the only question I have is, like, in the event that you decided at some point to change your menu, this would obviously either prevent you from doing that or create a situation. So I didn't know if you had any thoughts around that.
Yeah, thank you for bringing that up. That's a thoughtful point. I would hope that the internal grease trap would cover us for anything that we would want to implement down the future. Our business model, and this is, what we stand by is that beer and wine will always be our focus, not food. We are going to have food trucks and a food trailer at the establishment that obviously will have to go through you guys and will be a whole separate operations, but will be outside of the tap room to facilitate a full menu. So going forward, that will always be the plan, our food trucks and food trailers outside, of the existing patio parked there. And that's what we brought to the other committee as well in Ashland, the planning committee. So, and also the space is very tight in the tap room. And so given that our mission is always to provide the best beer possible and the best wine possible, I don't foresee us switching our focus so heavily onto food that we would need an external grease trap to support that.
Ed, I have a follow-up question for David.
Go ahead, Raj.
David,
Yeah,
David, thank you for pointing it out. And you said that you have a food truck coming into your place. Is that correct?
Yeah, so we're hoping to establish a permanent food truck or a food trailer that will obviously go through you guys with a separate application. It's going to be a separate LLC, a separate application, and it is obviously be parked outside of the brewery, but they will not be using any of the facilities inside the brewery, any of the storage. It's a completely separate entity. I just bring up that point so that everyone knows that food will be offered and will be an option, but it's a separate separate business, basically.
Right. Assuming that they won't wash their dishes here, oily dishes too. That's another condition that we need to make sure.
Well, so we will have to wash dishes because we have glasses.
So your dishes are fine.
Our dishes, correct, right?
Yeah, but
no,
not
so we won't.
Not from the food truck.
Yeah. So we support food trucks in Hudson today, and we keep them outside, and most of the dishes actually are disposable. So I don't see them actually. I would say 99% of food trucks don't have permanent dishes or glassware. Most of them are disposable. Mm-hmm. But they would not be using the interior of the brewery.
Okay, that's good.
Great, thanks.
All right, so I'll make a motion to approve the grease trap waiver for 151 Main Street, Clover Road Brewing Company.
I second that.
Any further discussion or questions? All in favor?
Aye.
Aye.
So that's unanimous. Congratulations. Good luck on starting your business here.
Thank you. We look forward to seeing you all in Ashland, hopefully very soon.
Sure.
Great. Okay, the next thing on the agenda is the reappointment of the burial agents. It's a 3-year appointment. The people are our town clerk, Cindy Livingstone, deputy town clerk, Chris Sullivan, John Matarese, and John Matarese Jr. Raj, this is just a vote, right, on this?
That is correct. So the only thing we are doing different this year is, right, we are doing a 3-year term instead of a year term that we used to do earlier. But we have checked, there is no limit on the time that we can do that, so just that's why we're doing a 3-year term. Yes, this just a vote on that, please. Yes.
Yeah, may I make a motion to approve that for 3 years?
Okay, we have a motion. Do I have a second?
Second.
Jay, second. Okay, all in favor?
Aye.
Aye.
That's
Aye.
unanimous. All right, Jay, you're up next for the RAM Clinic.
Okay, hi everyone. We are pretty close, like a couple weeks out now. Before I forget, if anyone here wants to volunteer and has not already signed up, please go onto the volunteer website and sign up so we can get a head count. But yeah, we are doing well. I don't really think there's any significant new stuff to report since the last time we met. Money is coming in. I think that we're going to do okay with fundraising, so we're very close to our goal. Aside from that, I think we have pretty much enough volunteers in every service area. There was a couple of more eye professionals, that would be nice, but I think we can go with what we have now. And I think that that's all I really have to report at this point. We just need to launch it. Ed and Dave,
Yeah.
do you guys have anything to add?
So, yeah, Jay, I haven't had a chance to talk to you. I had a great discussion with Assistant Superintendent of Framingham Public Schools, who got me in touch with the school nurse leader for the district. The flyer for the vaccine clinic and the RAM clinic is being pushed out to Framingham Public School families, and they are doing a big push within the district for additional volunteers, including interpreters.
Excellent. All right.
Jay,
Yep.
question. Is the spectrum of physicians that you have, do they evaluate every age group, or is it only for certain age group that you are looking at?
We have one pediatrician that has registered, but there may be other adult physicians and nurses that are comfortable doing, general childhood exams to get them ready for school. They might be. I'm not sure about that.
You're content with the number of doctors, or you need more physicians?
We are content with the number of doctors, at least that's what I'm told from RAM right now. It doesn't mean that we couldn't use more or that they would be put to use. So if somebody signed up, we would make sure that they have something new.
Yeah, there are a couple of people that approached me, so I will give them the link and then they can go and register on that. That'll be good.
Okay. Yeah, and like I said, that one pediatrician, it's not the person that we had last year. At least I don't recall the name. It's the same, but we had a couple of, I think, pediatricians last year. This year we have one. If there was another pediatrician, that would be wonderful.
I'll get you one.
Okay. All right. So yeah, if they can go on the website, sign up. One thing that I've been telling people that when they get to that website is you'll get to an area on the online portal where it's events and assignments, I think is what it's called. And under that, there are 3 drop-down menus. But all you have to remember is that you'll have an option between RAM events and RAM clinics. And if you choose events, you're going to go down the wrong path. You have to choose clinics. This is a RAM clinic.
Okay.
If the folks sign up for a RAM clinic, then they'll be given the opportunity to pick Framingham, and their assignment and everything should flow more smoothly. So RAM clinic.
And people who want to make use of the clinic, do they have to register too, or?
Not online. They would just show up and they'll be registered on site.
Okay. And you had told me last year they had somebody who was making dentures on the site. Is that person still on, or is that option there?
My understanding is that person will not be there. If he is there this year, we'll all be surprised because I guess nobody has heard from him. So we're not telling anybody that. And even last year when we had that person doing dentures, we didn't announce that until just a week or so before the clinic. Yeah. There was one more thing I was going to mention. Just a question, I guess, for Ed and for anyone here. Do we know of a mechanism by which we could get Narcan to hand out? And the reason I ask that is that the public health service will be there on site. They'll have about 15 officers. One of the things they want to do is have a Narcan training, which should be no problem. And I've been to clinics where they have this. They train patients as they're coming out of their service area to give them education in overdose and the use of Narcan. And they can get Narcan for training, but they can't, I don't think they have a way to pick up a bunch of these to hand out. So Ed, do you know, are we connected?
I know Raj has some cases. I can grab a couple of cases too. I don't know how many doses they would need.
How many
Raj, what do you have for stock?
Mr. Berman, I can request more. Dr. J, we do have a program. We do have Narcan availability to our residents under a grant that we have here at the department, right? So just to add on that, so I will request more Narcan for the clinic and see where we go. But we definitely have, I guess, maybe 3 or 4 boxes in hand. So I guess we should have sufficient supplies, for the clinic.
Is that regulated in terms of distribution, or is that? anybody can have it. Okay.
We just, Mr. KG, we just need to train anybody whom we hand over Narcan. You know, we just cannot just give it out. You know, any person we give Narcan, we need to train them on how to use it. You know, that's the only requirement. You know?
Yeah, I'm sure Ed knows about it because he has been the czar here in Ashland. For a long
He
time.
actually trained us to train people. You know, so he's the master trainer. But I just want to point out, you know, somebody if anybody's listening, you know, so. But we have to train them before we hand out the Narcan, you know, so thank you.
So Raj, can I then put you in touch or connect you with this PHS officer who was asking me about this, and she just emailed me about it today. I'll just connect you by email and then do what you can. I mean, I don't think she expects you to use all of Ashland's supplies for the RAM clinic, but
Dr. J is for the residents, is for the public. You know, we'll be happy to distribute as much as needed or whatever supplies we can get. You know, so yeah, it should not be a problem. You know, but yes, please.
Raj, I have a couple of cases in my office too. So if we don't get the one from the state in time, I have some in my office.
Wonderful.
Oh, great. All right. Well, I'm glad I brought it up. I'll connect you, and then Ed will get back to you with his stock.
So, one other question that I have: are we allowed to just visit anytime, or as members of Board of Health, or restricted?
Yeah,
or
definitely.
Do we have to register?
Well, that's a good question. I can ask if you actually need to register. I think that RAM would probably say, you know, if you're on site, they want everybody accounted for.
Sure.
But, you know, even if you had to, KG, you could register on site and come in and get a tour.
I will. Sure. Thank you.
Yeah. Okay.
Bye-bye.
The one last thing about the volunteer registration. I seem to remember the folks from RAM mentioning that they closed the registration about 2 weeks before. I think it's exactly 2 weeks before. So that would probably make like this Friday, the 26th, the last day to register. So anybody who's planning to register to volunteer, do it soon.
Yeah, good point. Good point. Thanks, Dave. Anything else, Ed or Dave, that you want to add? Okay, so I think we're in good shape, and I know that we're not going to, at least I don't think we're going to have another Board of Health meeting prior to the clinic. So if anybody has any questions, just email me or text me, or you know how to get in touch with me.
And Mr. Chairman, I just want to add one more point, you know, to Mr. KG's question about the physicals. I know it was a little different topic, but we do at the department with our childhood vaccine clinic, right? We have a program under which we can get free physicals for any school-going kids, right? At convenient MD locations. We have voucher system that we can provide it to them year round, right? They can go get a physical, you know. If it's just like, if it is not feasible in the clinic for documentation and all that, we have a program where all the kids can get a free physical from convenient MD. I just want to put out there, you know.
Great, excellent.
Thank you.
I have a question for you, Raj. So Ashland will have a table at the clinic like last year, right?
We will have a table from the shared services. So yes, you know, we'll have a combo table. Yes.
So you could have all those special information available to them if there is a pamphlet or something, if there is a resident who wants to get information.
We will have that. So yes.
Thank you.
So Raj, I'm going to send to you the agreement form that all the community resource groups need to sign. It's a one-pager. You signed it last year, or somebody signed it last year. And you can give it to whoever needs to be the signer on that and give it back to me. And then whoever is going to be at that table, you may remember, needs to register as a volunteer, and there'll be a spot in the portal that where that person or those folks can say that they are in a community resource group. And so we'll have the table set up. Am I going to see you on the setup day, Raj?
Absolutely, yes.
Okay, so we can talk about like where you're going to be and all that, but whoever's going to be at that table should sign up, and I will send you the agreement.
Yes, sir. Thank you.
Okay, thanks. All right, I think that's all I got.
Okay. All right. Next, you're up next, Raj, for the health director's report.
Thank you, sir. Yeah. So on the arbovirus, we so far in the state we have 9 triple A. Now these are the mosquito samples that we have 9 of them positive in the state. Then we have 16 West Nile positive mosquito samples. So far, no human or animal cases, but just with the mosquito samples, the numbers are still high for the season. So just caution on the mosquito bites and all that. If the folks can wear repellents and all that, if they go out in the evening and all that, that'll be good. Other than that, the Central Mosquito Program, what they're doing this year, they are spraying private pools, abandoned pools. So far for the season, we have got sprayed 2 pools. And then there is another pool that we are currently dealing that we have issued an order to correct letter because that's an abandoned pool and there is overgrown vegetation at the property. All of our recreational water with Washukum Pond and our 3 beaches are closed because of cyanobacteria. As unfortunate, but all our water bodies are closed for right now for swimming or any other recreational use. Just on the updates on the septic system side, the 2 properties, I know 27 Dean Road was in front of the board last time, and Mr. Berman have asked me to communicate with the property owner as well as the installer or the engineer. We have done so, and they have not gotten the permission from Eversource yet, but they are in touch with them. So that's going on. And another property, 11 Tower Road, the system, we was doing the inspections here, and there was some conflict that was there between the installer as well and the property owner. I guess we have a resolution for that, and we should be doing the inspection soon. But there was a gap, right? They didn't cover the system for almost a month. This was at 11 Tower Road, and I will keep the board posted once we finish this system. Frozen desert license. So we have a request from one of our vendor, Dolce Dolce, that they are looking for a frozen desert license. That for currently we don't grant this kind of license. It's just for the frozen ice cream, and I just want to ask board if you have any concerns or anything, any questions on that. But moving forward, we will start granting that kind of license. Starbucks, we did the final inspection yesterday, and we have signed on the COC. They plan to do a opening event on this Friday, I guess, but they are all set from our side. We did two pre-opening inspections, and they are all set from Board of Health side.
Raj, can I ask you a quick question on that one? Since it's a new business, have you met with the manager or who's the?
That is correct, Mr. Berman. So both my pre-opening inspections, right? The manager, I guess his name is Mr. Miller. He was there. So I met him. Yes, so he's gonna be the manager for the property. Yes.
And Tom will do a check-in like relatively within a short period of time once they open.
That is correct. So usually we plan to do a operational inspection within 2 weeks, of them going in operational.
Okay, thank you.
You're welcome. Mill Pond Rest Home, I checked with the ownership last week. They said the change of ownership is still going on. They are going through some paperwork, and they expect mid-August that might happen. The only thing was, like, I have not gotten the pest control that they have agreed to provide it to board every 3 months, right? So the last pest control report I had was from April 12th. Hopefully I get one for this month, that is pending, and I'll keep the board informed, Updates on our housing cases, 55 Codeville. Dr. J was with me last time we went for the re-inspection. Thank you for that. After that, we have gotten the second pest control report this week. did shows a little bit of the activity, rodent activity on the report. So we'll be looking for more pest control report from the owners of the property. I guess they have signed for 3 months of pest control on their property. Chestnut Place Apartments, I was there this morning, had some issues with the trash, and I've issued a $100 ticket or citation this morning. In between, they was pretty good, with the trash situation. But today, when I went in for the inspection, I saw a lot of stuff and issued the citation. Cirrus Apartments, we have picked up 2 more cases. There are 2 housing cases. One is in building 6 and one is in building 9. And so we're working with the management on that. Update on 137 Pond Street. The AG's office have filed the case with the court now. Our first court hearing is on September 4 at 9 a.m. At the Worcester Courthouse. So I plan to attend that. 213 Trailside Way, they have corrected all the violations. I had a conversation, email exchange with the owner, and I should be doing a re-inspection there soon. With disease investigation, we have 2 active TB cases that we are following up. And then last week we had a 1 Campylobacter case, and we had 1 this week as well that we are following up. And I guess that's all, and I'm open for any questions from the board.
Anybody have any questions for Raj?
Nope.
No. All right. Thanks, Raj. Appreciate
Thank
that. Next thing on the agenda is the consent agenda. So do I have a motion to approve the consent agenda as presented?
So moved.
I can't vote on the minutes because I wasn't there, Ed.
Okay.
Yes.
So you want to pull that out and then vote on that separately, or?
Or just do the consent agenda with it. We have a quorum without me,
Yeah.
right?
Yeah.
All right. So we have a motion. So Jay, you're just going to abstain then, correct?
Yeah.
Okay. So we have a motion. I will second the consent agenda. So all in favor?
Aye.
Aye.
So Laura, for the record, it's 4 and Jay's an abstention.
Yep.
Okay. Next thing on the agenda is to discuss future agenda items, upcoming meeting dates, review revised tobacco regulation and tobacco sales permit application, and an August meeting date. Raj, you're gonna pick that one up?
So still working on the tobacco regulation, Again, if somebody is interested, I can send, as I have a draft ready. Any board member want to take a lead on that with me? That'll be great. If you want to email me on that, wonderful. And then meeting date, Mr. Chair, if you see if we should do it before or after the RAM event, so that's up to the board,
I think, my feeling is unless we have anything pressing, we should do it after RAM.
Correct.
Because we typically do only one, right? So we can aim for maybe the 20th, or because 13th is going to be too close to the event and everybody, given 3-day event,
Yeah.
But again, whatever board decides, or I can reach out, to you, if when the need is, and then decide,
Yeah, why don't we do that? We'll leave it open-ended for now, Raj.
Sure.
Wonderful.
So does that mean definitely not the 13th?
Right, we won't do one on the 13th.
And maybe on the 20th, and we'll wait to hear back from Laura or Raj.
And if there's nothing, we'll hold out till the 27th.
Yep. Okay.
Raj, I'll volunteer for the revised tobacco regulations.
Wonderful, sir. Thank you. I will send you the draft, and we can have a discussion, whenever you have time, on the changes and all that.
Okay.
Thank you.
And so if you guys need a second reader, you just want it proofed before it goes, official or before it's voted on, I'm happy to read through it too.
Great.
Yep.
Raj, I just would like to take a look at the applications. That's all.
Sure.
All right, well, if we have nothing else, I will entertain a motion to adjourn.
So moved, sir.
And,
Second.
Second.
all right, good night, everybody. Thank you.
All right.
Good night. Good
Good
night.
night, everybody.
Good night.
Thank you. Have a good night. Thank you.
See you all at the clinic.
Yep,
Yes, sir.
Okay.
you're there.